Welcome back once again. It's your boy Abdul, the Health Man, here on the Grown Folks Podcast. We are here Sunday nights, 9 p.m. Eastern Standard Time on the Grown Folks Podcast. Today we have a different topic. As always, I sometimes trying to think of different topics. This one came about because at one point in time, my mother was in a rehab center, and she was bedridden for a while. And one of the things they did in the rehab center was want to move her around and get her up and get her out and stuff like that to prevent bed sores. So I thought about an important topic that happens to people who are in rehab centers, who are in hospitals, who are diabetic, who have infections. It is wound healing. That's right. We're going to talk about what is a wound and how to heal an open wound. This affects a lot more people than you will really know. You ever know somebody who's diabetic? One of the things they always look out for is protecting their feet. Protecting their feet. And that's because they do not want to get a wound there that can lead to an infection, that can lead to amputation. This is extremely important. So wound health. Important talking wound. People who are diabetic will definitely understand this. People who have family members in a nursing home will definitely understand this. And people who ever had a skin infection that is caused by a delayed healing will want to know about this. So what is a wound? We're going to talk about what is a wound. A wound is an injury that breaks the skin or other body tissue. Wounds can be open, with broken skin, exposed body tissue, or closed when there is damage to tissues under intact skin. Okay? So a wound is always not open. It can be also underneath the skin. Okay? It's exposed, damaged tissue. Different types of wounds. We're going to talk about this, and then we're going to go a little bit in deeper. Penetrating wounds. A penetrating wound is a punctured wound, a surgical wound, and an incision wound. Thermal or chemical electric burns are wounds. Bee stings or bites or stings are wounds. A gunshot, we know that's a wound, or any other high-velocity projectile that can penetrate the body. Okay? These are called penetrating wounds. They speak for themselves. When they penetrate and they break open the skin. Okay? Penetrating wounds. Blunt force trauma, abrasions, lacerations, or skin tear. These are also types of wounds, okay? And then you have closed wounds are often caused by blunt trauma. So a closed wound is usually often caused by blunt trauma. Though injured tissue is not exposed, there can be bleeding and damage to the underlying muscle or internal organs. You ever see a boxer who get hit really hard with a liver shot or a kidney shot? They go down, sometimes they will pee blood. They will urinate blood out. They have damaged the kidneys. They have damaged the liver, or their body will actually urinate out blood. Because a wound does not necessarily mean it's an opening. You can get it from blunt force trauma. Okay? A contusion is a type of blunt force trauma causing pressure, damage to the skin, or underlying tissues. A blister. Man, my son just got this maybe a couple of months ago. He developed a blister. A blister happens, he got his from skating. You ever been to the roller skate ring, you're skating, and the shoes, your foot is sliding back and forth, and you don't have the proper socks on? You can develop a blister. Okay? That is a wound, but it's not an open wound. It is a closed wound. A seroma. This is a fluid-filled area that develops under the skin or tissue. Okay? A hematoma. We've heard of these words. Hematoma. This is a blood-filled area that develops under the skin or tissue. Okay? Occurring when there is internal blood vessel damage to an artery or vein. You ever seen somebody get a hematoma? You know, they have a blood-filled area underneath their skin. You know, or crushed injury. crushed injury. That speaks for itself. If somebody break your leg, if a car run over your leg, you have what they consider a crushed injury, a crushed wound. These are internal wounds. They're not open, but these are wounds. All right? And like I said, this whole talk today, we're going to talk about wound health. Now, there's a third type of wound. Okay? Now, we talked about the open wounds. These are puncture wounds and penetrating wounds. Then you have blunt force trauma. These are closed wounds. Then you have another type of wound, and it's called an ulcer. An ulcer. An ulcer are a third type of wound, which there are 4 main types. There's a pressure ulcer, a venous ulcer, arterial ulcer, and a neuropathic ulcer. Okay? A venous and arterial ulcers are vascular wounds caused by problems with the circulatory system. As the name suggests, they result in an insignificant blood flow to a vein or an artery, respectively, okay? Both types are painful, most commonly found in the leg and the feet, and can lead to infections such as cellulitis, okay? This can lead to an infection. A neuropathic ulcer, on the other hand, may be painless, because it arises from minor trauma not noticed because the loss of sensation. You ever heard of somebody having diabetic neuropathy, known as perineal neuropathy? What happens is that the actual nerve endings from a diabetic patient gets damaged by the blood sugar. And that person now can develop a neuropathic ulcer. And why is this dangerous? They can develop an opening on their foot, opening on their hand, these ulcers, and they can't even feel it. There's a show on, a program on YouTube I like. It's like a foot doctor. And one of the things he specializes in is diabetic patients out of D.C. It's a brother. Diabetic patients out of D.C. And one of the things you notice, most of the older diabetic patients all have foot ulcers. And his job is to clean it, wrap it, and prevent it from becoming any greater. And the crazy thing about it, these ulcers are a quarter size. They have literally a hole going all the way through, sometimes up to the bone. And they do not feel it. They do not feel it because the blood sugar has damaged the nerve ending so much they can barely feel it. A lot of times they feel it feels numb. Peritoneal neuropathy interferes with the ability to sense injuries, like I said, leading patients unknowingly placing stress on limb pressure points until it develops ulcers. Diabetics are the most common cause of peritoneal neuropathy or neuropathic ulcers. Okay? This is a vascular disease as is present, and there's a greater risk for infection and amputation. May be sometimes necessary because of these type of ulcers. All right? So understand, these are wounds that we're talking about. These are wounds that we're talking about. And it's very important to understand wound care. This is what this whole thing is about, how we're going to deal with wounds. Okay? There are many factors contributing to chronic non-healing wounds. We're going to go through these factors, including systemic illness. You've been sick for a long period of time. Systemic illness. These are just illnesses like diabetes and all, that you're just sick a long period of time. Your age is more likely that it's harder for the body to heal as you get older. Okay? Repeat trauma. Continuous damage to the same area. What do we say? Diabetics sometimes put pressure on certain points on their foot or on their limbs that they don't even recognize. Developing an open sore or ulcer or wound. As And this can come from such conditions as diabetes, anemia. That's right. You can develop wounds from anemia, hard to repair, cancer, other long-term medical conditions, including arthritis or kidney disease. Okay? Heart issues such as high blood pressure, heart disease, varicose veins. Varicose veins. Okay? Immobility, such as being confined to a wheelchair or a bed. These are called bed sores. Someone who's in a wheelchair can develop sores. So they start to develop these wounds underneath their buttocks or on their bottom of their leg and stuff, but usually on the buttocks. Habitual habits such as smoking, and unhealthy diet and inactivity. Why smoking? Because smoking affects your blood vessels. It constricts them. It damages them. It reduces your circulation. A weakened immune system from chemotherapy can affect this and cause wounds to stay open. If you're on immunosuppression medications, okay, or medications for like diseases like HIV or AIDS, an infected wound, okay, circulation problems, we talked about that. If you have a history of ulcers or if you're on certain medications, can contribute to the fact that you're not healing properly. These can contribute to the fact that you're not healing properly. Signs of chronic non-healing wounds are similar to infected wounds. I want y'all to understand this. Signs of chronic non-healing wounds, the same symptoms of having a non-healing wound, are similar to someone having an infected wound. That means if you've been developing bed sores, it's no difference. The symptoms you're going to have is the same way if I went outside and I cut my hand and the bacteria got in it and it became infected. These signs that you will see, these symptoms that you will see would include pus. Someone has a non-healing wound. You'll include redness and warmth around the area. It's being infected. It may develop a bad odor. You will have increased pain. It hurts if you have an open wound. You also have darkening of the skin at the edges and a fever. Okay? So understand this. Excuse me. When you have chronic non-healing wounds, it's almost the same as basically having an infected wound. The symptoms are the same. And it could because it's continuously getting infected. But just the simple fact that it's staying open for a long period of time, these are the issues. Wound complications. Most common complication of an open wound is infections. If that infection goes undiagnosed and untreated, it can cause cellulitis, a painful bacterial skin infection. This thing hurts. It can spread to underlying tissue and bone. It can cause a condition called osteomyelitis. Infected wounds can lead to sepsis, which can cause organ failure and in severe cases, death. I'm going through all this because I want y'all to understand why is it important about wound healing and how to keep wounds from staying open, to help heal these wounds, because it affects more people than you know. It affects a lot more people than you know. It's affecting people in, like we said, nursing homes. It's affecting people and goes into hospitals. It's affecting people in long-term care. It's affecting people that is bedridden. It's affecting people that are wheelchair bound. It's affecting people that are diabetic. It's affecting people that are dealing with cancers. It's affecting people who have high blood pressure for long periods of time. It affects so many aspects of people's lives. So we're going to talk more about it. All right. Additional complications of wound healing are peri-wound dermatitis, a form of skin damage. You have edema and peri-wound edema. You know anybody who ever dealt with edema, swollen legs? Edema causes compression of the small vessels and decreased blood flow, increasing the likelihood of pressure of an ulcer or injury. We talked about hematomas, a collection of blood outside the blood cells. We talked about diahistis, is a splitting or bursting of a wound. And you have a maceration, is a macerated wound occur when the skin is in contact with moisture too long, slowing healing and making the skin more vulnerable to infections. This can happen actually sometimes when a person wears a Band-Aid or wrapping too long. You know, if you wear Band-Aid sometimes too long and is not getting air and the skin around it is moist, it actually slows down the wound from healing. That's why they say you should wrap it with a Band-Aid and sometimes take it off at night so it can heal and dry out properly. And this is very important. So these things are some of the symptoms or some of the information, some of the names and understandings of what wounds are. So we went through all that medical jargon to understand what is a wound and the definitions of different types of wounds. Now we're going to talk about what you can do outside of medical intervention to help you heal the wound. Outside of medical intervention. Because sometimes the wounds are bad. You need medicine. You need medical intervention. You may need surgery. You may need antibiotics. You may need proper wrapping. You may need all of these things. But we're going to talk about things you can do at home that will help you heal. So let's talk about foods that will help you heal. First and foremost, you must avoid sugars. Oh, Abdul, why I got to avoid sugar? I'm not diabetic. It slows down the healing process. Processed sugars slows down the healing process. Okay? Processed sugars slows down the healing process. So you must avoid processed sugars. Second, you must drink water. You must stay hydrated. Why do I need to stay hydrated, Abdul? Because the body needs the water, so it allows the blood to circulate properly. Because dehydration is actually a lack of water in the cells as well as in the blood, making the blood thicker, causing it to reduce blood flow, causing it to make harder for the body to repair, because the way the body repairs is by sending nutrients to the area through the blood, as well as through the lymphatic system, but through the blood. So you must hydrate when you are dealing with open wounds. Being dehydrated makes you heal slower. So you must stay hydrated. Drink water, anywhere between 4 to 6 cups a day, and get water-rich fruits and vegetables. Third, eat foods rich in vitamin C. Eat foods rich in vitamin C. And we're going to go through a list of things that can help. Foods. Why rich in vitamin C? Because the body cannot produce collagen without vitamin C. The body cannot produce collagen without vitamin C. Tell me what your skin is made of. It's made of collagen. Tell me parts of the muscle fiber is made of. It's made of collagen. Tell me what your joints are made of. They're made of collagen. The structure of the body is a collagen matrix. If I was to put you on a scale, about an eighth of your body weight, if you're a normal weight, about an eighth of your body weight is made of collagen. An eighth of your body weight is made of collagen. Your bone structure is minerals in a collagen matrix. Your ligaments and tendons are made of type 2 collagen. 1 and 3. Your cartilage is made up of type 2. Your skin is made up of type 1 and 3 collagen. They cannot be produced. Collagen cannot be produced without vitamin C. And how do we know that? Because if you do not get enough vitamin C, you have what they call a deficiency in vitamin C. You develop a deficiency disease called scurvy. And we know scurvy is what? The breaking down of collagen. And we learned that scurvy usually happened in voyages overseas because the sailors did not have fresh fruits. So what they did was they started to die off because they would bleed through their skin, they would bleed through their eyes, they would bleed through their nails, they would bleed through their body, right out their blood vessels would break, and they called that scurvy, a deficiency of vitamin C. And the way they used to be able to help with this is they used to store lime juice on their ships, and they called them limeys. But we don't have to worry about that because we're in an environment of today where we get tons of vitamin C if we eat enough fruits and vegetables. So eat enough fruits and vegetables that's rich in vitamin C, and we're going to start with bell peppers. We're going to start with bell peppers, one of the best foods you can eat if you have an open wound. Not only is bell peppers rich in vitamin C, but they're also rich in silica that's excellent for strengthening the skin and making the body produce more collagen. It's a very rich source of silica that makes this body produce more collagen. That's going to help you close the wounds. It's going to help the body heal the wounds. So when you consume enough bell peppers a day, and it could be the red, it could be the yellow, it could be the green bell peppers. But if you know you're dealing with diabetic neuropathy and you have an ulcerated foot, you have ulcers on the leg, you have a wound somewhere that's not healing properly, bell peppers is number one thing you should be eating. And you should be actually juicing it, along with a cucumber and some celery. Because even though we're doing fresh fruits and fresh vegetables, we still want to keep the sugars down to a minimum. But bell peppers is number one that you want to consume if you're dealing with an open wound. And if you know somebody who's dealing with an open wound, they should be consuming bell peppers. Will definitely help them heal faster. Green leafy vegetables. I don't need to go through what green leafy vegetables are. We know the green leafy vegetables. We talk about them all the time. Collard greens, kale, spinach, all those things like that. Boston lettuce, all that stuff. Blueberries, rich in vitamin C, rich on antioxidants called anthocyanins. Rich in antioxidants. These antioxidants protect the blood vessels, strengthen the blood vessels, improve blood circulation. Excellent for keeping the skin healthy. Excellent for reducing inflammation. Why is this important? Because when you're dealing with an open wound, you want to repair the skin as well as you want to improve circulation because not every wound is open. We learned that. We learned that you can get that through blunt force trauma. Not every wound is open. But when we're talking about wound health, we want to deal with the outside wounds as well as any internal wounds. And blueberries will help with that. Bananas speaks for itself. Another one rich in vitamin C. Camu. C-A-M-U. One of the richest sources of vitamin C in the world is a Brazilian fruit. It's a Brazilian berry. It actually does not taste good. It's so rich in vitamin C, it doesn't taste good. It's super sour. You can buy it in powder, or you may be able to buy the dry berries if you can find them. But camu, one of the best for helping you heal. Not only is it excellent for helping you heal when it comes down to wound health, for internal and external wounds. Not only does it help you produce more collagen, it is an excellent antioxidant. It is one of the best natural antivirals. One of the best natural antivirals. Oh, you dealing with a cold sore? Start drinking camu. Eat camu. It will help you. Baobab, another rich source of vitamin C. Another superfood. Another one that's rich in fiber and a powerful potassium-based fruit. Baobab is one of the best. Excellent. It comes from Tanzania. It comes from Ghana. It's rich in Africa. Okay? It consume your kiwis. Another good one to help your body heal its wounds. Potatoes and tomatoes. These are also rich in vitamin C to help you. And any other vitamin C rich foods. Citrus fruits such as your pineapples that have bromelain in it that helps break down excess of fibrogens that can improve blood circulation. Tons of vitamin C rich foods. But it's not just vitamin C rich foods that helps you produce more collagen and makes your body heal faster. You want to eat clean sources of protein. In this aspect, you can do walnuts. You can do almonds, organic. You could do pistachios. These are rich in omega-3s. Cashews, rich in omega-3s. Also, anti-inflammatory, makes the body heal faster. Remember we talked about how the body wants to heal? You got to put out the fire, and you got to bring the construction workers too. When your house is on fire, you got to put out the fire first and bring in the construction workers. The omega-3s are going to put out the fire. The proteins in the vitamin C rich foods are going to bring in the construction workers. You can consume pasture-raised chickens, pasture-raised eggs, grass-fed beef, soybeans, organic. You got to make sure your soybeans are organic. Chickpeas, kamut. This is the heirloom wheat. You can do quinoa. All these things that are rich in protein are going to help you because the collagen is a protein. Collagen is a protein. If you damage an organ, it is made up of proteins. So you want to consume proteins to help you heal faster when it comes down to wound health. One of the things that happens as we age, what happens is that we start to lose muscle mass, we start to lose bone density, and our collagen starts to break down. So when you develop a wound, external wound, an open wound, and it is taking a long time to heal, the body requires certain things. It requires more vitamin C rich foods. It requires more protein to help it repair. That's why as you get older, your actual protein level in which the body requires goes up. It goes up. When you are 20s, 30s, if you're just working, you're not an athlete, you need about 0.8 grams per kilogram of weight just to stay healthy in the amount of protein. Doesn't matter what source you get it from, just to stay healthy. And you're an athlete, you need about 1.2 grams to a kilogram of weight if you're a strength athlete or you work out. When you get older, when you're over 60, they actually want you to get up to like 1 gram to 1.1 grams per kilogram because now the body is wasting protein. It is breaking down protein faster than what it's putting back in. And you see that somebody's muscle tissues get smaller. As you get older, all of a sudden you start losing muscle mass. That's because the body is using protein more. It's burning it up. And this is important because this is one of the reasons why someone who has an open wound takes longer to heal as they get older, as they get older. Because most elderly people, or most older people, not elderly, just older people, are not consuming enough protein to make themselves heal faster. Or the quality of protein that they're consuming is low. So consuming enough protein and consuming enough vitamin C rich foods can make a person heal much faster. Now, let's talk about the supplements that can help. And we got a whole list of them. Let's start with zinc picolinate, or zinc in general. But I like zinc picolinate, a highly absorbable form of zinc and a great transportation method in the picolinate or picolinic acid. It allows the zinc to be able to travel and be very useful in the body. Okay? You're going to waste less of this zinc. Zinc is one of the best for keeping the immune system healthy, but zinc is excellent for healing wounds. Zinc is excellent for healing wounds. If you ever get certain wound creams, they actually have zinc in it. Because zinc is excellent for stimulating the body to heal wounds. And zinc is excellent for dealing with skin health. Okay? So zinc picolinate. We already know. I said vitamin C already. So if you're going to eat the vitamin C rich food, why not take a vitamin C tablet? The more the merrier in this situation. The more the merrier. Not only vitamin C, but you could take collagen powder itself. You could take collagen peptides powder. You could take collagen tablets. You could take collagen liquid. You could take collagen gummies. Whatever which way you want to take your collagen, take it. You just want collagen type 1 and type 3. That's the most abundant form of collagen that we have in our body. Type 1 and type 3. That's the stuff that make up your skin, your hair, your nails, your joints, your blood vessels, parts of your muscle fiber is made of type 1 and 3 collagen. Consuming type 1 and 3 collagen will help you heal faster. People come in the store, they ask me, I'm going through surgery, what should I take? I tell them certain things, and one of the things I always tell them to take is collagen because it makes you heal faster. If you have an open wound, you want to take collagen because it helps you heal faster. Another thing you want to do is take cayenne pepper. Cayenne pepper. Why cayenne pepper? Because cayenne pepper acts as a catalyst. Anything you take with cayenne pepper, it makes the products work better. If you take zinc with cayenne pepper, your zinc going to work better. If you take cayenne pepper with vitamin C, your vitamin C is going to work better. You take cayenne with your collagen, it's going to work better. Why is that? Because cayenne acts as a catalyst. It improves absorption of all those nutrients, and it improves the circulation, getting the nutrients to where they need to go. Cayenne improves blood circulation. It will get the nutrition where it needs to go. And when you improve blood circulation, you improve the likelihood of a wound healing better. If you have ulcers in your foot, if you have an ulcer in the back of your leg that's not healing, if you have an ulcer between your fingers, if you have a wound on your buttocks that's not healing, you have a wound underneath your arm that's not healing, start taking cayenne pepper. You get circulation to that area that definitely can help improve your situation. Also, cayenne has an antioxidant in there called capsaicin. That's really good for helping the body heal, especially if you have any problems with your eyes. Okay? Cayenne pepper. You also have butcher's broom. Butcher's broom is another excellent herb because it works because it improves blood circulation as well as it strengthens the capillaries. So if you're a person that's dealing with bad circulation and you're dealing with varicose veins that actually causes you pain, or you may have an ulcer on your leg because you have varicosity, Butcher's Broom can help. Butcher's Broom can help. Or if you have continuous skin infections that causes the skin to open, Butcher's Broom can help. As well as prickly ash, another great herb for improving circulation. Prickly ash. We talked about consuming proteins. If you're not a meat connoisseur, you don't want to eat meat, cool. I don't like nuts. All right, cool. Get you some amino acids. Specifically, you could take an amino acid called perfect aminos. This is actually a vegetarian form of an amino acid, but it's 99% absorbable. It's called perfect aminos. It will help you deal with muscle wasting. It will help you improve your skin. It will help a wound heal by giving you the amino acids in free form. So not only are you consuming protein, remember, protein turns to amino acids, but amino acids don't always turn to protein. And amino acids can go and repair where they need to go. So taking perfect aminos or other aminos like arginine, L-glutamine, or proline, this is an amino acid that makes the body produce more collagen. This will definitely help you out a lot. To help a wound heal. You can use creams like aloe vera or aloe vera gel will help it heal. You can put this on an open wound. It acts as a natural antibiotic, as well as it has healing agencies. Helps it scab up and heal a wound. Calendula cream or calendula tea can help heal a wound. Arnica ointment can reduce a closed wound. If you have bruises, arnica is one of the best. If you have a hematoma, arnica is one of the best. If you have an open wound, colloidal silver ointment acts as a natural antibiotic. It's an antiseptic cream. It keeps bacteria out, allowing it to heal faster. Another great herb that you can drink as well as put it on your wound is golden seal root, okay? But you want to get it in the powder form. You can make it like a paste. It will help heal the open wound. If you drink the herb, it still acts as a natural antibiotic to prevent the wound from getting infected, making it heal faster. An herb like Go-To Cola is one of the best for improving memory, but it also helps heal skin conditions. Go-To Cola helps heal skin conditions and will help heal an open wound. And grapeseed extract, another great supplement that improves blood circulation, gets more blood flow to the open wound, and releases or reduces blood clotting. It can deal with closed wounds too. So grapeseed extract. So that is the end of my topic today. I would like to open up the floor to questions. If anybody have any questions, please give me your questions now. Unmute yourself. And like I said,
Susan
this topic.
For the stats.
Yes. How are you?
How are you? How's your son?
Oh, they doing good. Everybody's all right. They went out running today. They're good.
Okay, great. Question I have for you this evening is about gelatin. Isn't that
yes.
a form of collagen? I mean,
it's not.
Someone told me about Knox. Can that be used also?
Yes, it can, but it's not a form of collagen. It's in that realm. It's very similar to collagen. Between collagen and gelatin, they're very similar. Collagen has a few more amino acids that's not found in gelatin, but the effects when it comes down to your skin, your hair, your nails are virtually almost the same. It's in the same family but it's not the same. They're very similar, though.
Okay, great. And you said there was another herb you just mentioned. I'm writing down notes. Blood clotting. What did you say that herb was?
Was it Go-To Cola?
Maybe it was that one. Okay.
Gotucola. Two different words. Go-To Cola. Kola. Go-To Cola.
And you mentioned that it was the perfect aminos for the aminos, right? For the amino
yes.
acids.
This is a product called Perfect Aminos. Very, very good. And it's also good for people who have muscle wasting, who also have burns, like somebody burnt themselves and they have muscle wasting from that. It's one of the best for dealing with that. It's called Perfect Aminos.
Okay, thank you very much.
No problem. And like I said, this was a different topic. This came about because, like I said, my mother was in a rehab center, and I could just see how people could develop bed sores. And it's a problem that a lot of people don't realize. I remember I used to have a coworker named Miss Marianne, and she had a nephew who had an open ulcer. God, I can't think of his name. I could see his face. He was Trini. And he was a great, what do you call that? Tailor. He was a great tailor. But he had an open wound, and he could not get rid of this wound for the life of him. And we started to give him herbs for it. And one of the things we had to do, it was funny. We gave him herbs, and it was helping, but it wasn't closing it. We got him off of coffee, and it went away. The caffeine kept the wound open. It's crazy. So, anybody else have any questions? Because now we're going to shut down early today. I guess this was a different topic. This is not your typical high blood pressure, cholesterol, diabetes topic. This is a little different. This is more of wound health and what to do about wounds, for us, like, as we get older. So, any other questions?
I have another question.
Yes.
No one wants to ask. We were talking, there was someone earlier on the podcast, not this podcast, but they were talking about using oregano. Now, I understand definitely what you're saying because my mother had a diabetic toe. And what I did was I diluted the oregano and used it, and with the other stuff, like you taught, I think they had other stuff they used with it, that I used with it, and it started to heal her. Of course, I got her off, all the sugars and stuff, as you said earlier, and she became non-diabetic, but her wounds started healing so nicely. So, I just thought that since it's such a antibacterial that I should use it, as so very potent. So what do you think about that?
I would say if they can tolerate it. You don't want to irritate the wound, but in your situation, if she was able to tolerate it and it did its job, that's cool. It's so many other things you can use. You could use tea tree oil on there. You could use, and that helps with healing a wound. It's really about keeping the infection down and getting blood flow to the area. That is the most important thing. Keeping the infection down and getting blood flow to the area. And by getting blood flow, you're going to improve how fast it heals, as well as you also need those vitamin C rich foods and those proteins. So you did everything you need to do. The first and foremost, like you said, a diabetic toe. You already know it just won't close up. It won't close up. And they just keep wrapping it. And that is the one thing diabetics fear, is making sure their feet stay healthy. Because when they start to deal with neuropathy, they can't even feel that it's you got a sore there or ulcer there. So, yeah, what you did was perfect. First and foremost thing was getting off the sugar, improving her diet, and keeping that area fresh and clean, or you can allow it to heal.
Yes, sir. Thank you so much.
No problem.
Abdul.
Yes.
Peace and blessings, brother. Quick question. Since we're talking about healing, I remember one time working in a particular spot. My arm it accidentally brushed up against an incense that was sticking out the wall. And to this very day, it keloid up. Now, from what I understand, I believe that African Americans, more so than any other culture, have a problem with keloids. All right? I was watching it came on BAI during their fundraising. There was a Dr. Gwen Scott, who unfortunately she had a thing called Home Remedies, how you wouldn't have to spend so much going to the store where you could just go to the grocery store, pennies on a dollar. Anyway, long story short.
Yeah.
what happened was they said, unfortunately, that, she found out something else. She's about to report it, and unfortunately, she had a brake problem with her car. She didn't survive. Anyway, you know how that goes, brother. But anyway, long story short, it would be nice, because I have a friend that was talking about that, and you might want to do a chapter when they're on keloids and solutions on how to reduce the scarring, because when I was watching Home Remedies, she was saying how if you get an onion, because it was a thing called Mederma, and I know some people that had used it, and they said not too good. But the lady said that she noticed that one of the ingredients was onion juice. So onion mixed in with, cold pressed organic olive oil. Mix it in, she was saying, it helps reduce and sometimes even make scars disappear. And if I'm not mistaken, keloids are in the same family as scars, correct?
It is. It is a type of scar. It's just a genetic trait that Africans usually have, black people usually have. It's been in our DNA, I guess, since the beginning of time, because as you see, it's not just African Americans, it's Africans themselves. In general, a lot of times when they get cut, they actually have scarring. And the scarring continuously grows, and then it doesn't stop where it's supposed to stop. It just grows a little more, and depends on the person. It can keep growing where it gets larger and larger and larger, or it just stops at a certain level. And so it may stop a half an inch above the skin. Sometimes it keeps growing. And you see that with some women who got the keloid on their ears, where they'll have a small one, and then years later it's bigger and bigger and bigger. And then they get it cut off, and then it comes right back because it's scar tissue that just continuously grows. I do know there's like certain acids. I remember my mother, she had scarring. She had keloids, and she developed it. And they will cut it off. And what they found was when you apply pressure to the area while it's healing, it doesn't keloid. That's one thing they found, that if the pressure is there to apply while it's healing, it tells the body to stop at a certain level. It doesn't allow the keloid to keep coming back. So that's one thing I do know, because my mother's got her surgically removed, and then they had specially developed earrings that had what do you call those? Give her extra pressure, like clip-ons that was more pressure. They was tight. So it wasn't like a regular clip-on earring, and it prevented the keloid from growing back. So I do know that. And it may be onions involved in some other things, but I do know pressure prevents it from growing back.
Well, for your mother, did it ever grow back? Or?
No, it never grew back. It never grew
back.
Right. Because while it healed, she had those earrings on that were specially made to apply pressure to that area that prevents the scar tissue from continuously growing. So it healed the way it was supposed to heal.
Oh, that's cool. And there's no side effect from that type of surgery?
No. Only thing you're doing is getting cut off, and then they're letting it heal, and then you apply this little. Well, this was for earrings. These were earrings that was for that. I don't know if you get scar tissue on your chest or anything. I don't know if they have specific bandages that can apply pressure to there. I just know that pressure needs to be applied to the area where scar tissue will develop that prevents the scar tissue from rising. So when it heals, it just heals normally.
I guess you get that information from a dermatologist.
Yeah, you can get some of that information from dermatologists. I don't know if onion works. It probably can. I just don't know. I don't want to say yes to something I really don't know.
Well, the lady I got the information from, and just to share it with you real quick, and for the people who are listening, when you're on my podcast, I mentioned it. I went to New York. There was a Dr. Spooner. I got the number from Dr. Kamal Kakai, who comes on BAI. I called her. I got her to come on as a guest. Long story short, she introduced me to a lady named Mama Naya over in Brooklyn. And she was Dr. Sabi's personal secretary for 17 years, an assistant. And I had an appointment with her this past Thursday. Myself and a friend went over there. And she sat down, brother, and told me stories about her long-term friendship with Dr. Sabi. And I was like, wow. In fact, I know you are knowledgeable with that Supreme Court case. She said she was there for that.
Yeah, I'm knowledgeable.
Yeah, she's 77 years old. And here's the mind blower, but that's why I got to have her come on. She said that she did a 45-day fast. And she said occasionally what she would do is she would take a spoonful of sea moss. And I was like, wow. She said one time out of those 45 days, she got a little lightheaded coming off the train. She sat down and she gathered herself. It took about 15, 20 minutes. She sat down and went about her business. So I'll bring on. I'll let you know.
Let me know. Yeah, that'd be real cool. That'd be real cool.
Yeah, she's rich in information, brother. Ooh,
yeah.
She got all kind of stuff on the shelves over there in the office. Mm-hmm.
Yeah,
okay,
I can
thank
imagine.
you, brother.
No
I
problem.
want to share it with you. Thank you.
No problem. Anybody else before we shut it down for the night? Oh, okay. Well, listen, I appreciate everyone for tuning in tonight to the Health Man Show. I hope you got some great information. I hope I shared something that you may have not known, or if you did know, you could share with other people. So, thank y'all for tuning in tonight. And I hope to see y'all here next week, same time, same place on the Health Man Show on the Grown Folks Podcast, Sunday nights, 9 p.m. All right, everyone, have a good